Uh, Good day. I'm now with uh, Dr. Butch Ong and Professor Benjamin Vallejo to discuss the misconceptions about prevailing about the current COVID-19 pandemic and how we can fight these misconceptions. Dr. Butch.
Well, uh, ever since the pandemic began, Phil, there has been a lot of questions about COVID-19 because there's a lot of unknowns about this virus. No? Although we have had SARS-1, I think way back 2003, 2009, no, early in the 2000s, no, it never really reached our shores. So uh, now that we have another SARS pandemic, which began 2019, that's what it's called, COVID-19, no, coronavirus infectious disease dash 19 for 2019. Um, People have not really understood what SARS-CoV-2 is or what SARS is. No, there are a lot of misconceptions about SARS. There's a lot of fear because of what we don't understand. No, and well, we have been battling this for more than a year since the start of the first detection in the Philippines last January 2019. No, we still have not understand fully what SARS-CoV-2 is, but we are slowly getting there. No, and the advocacy against these misconceptions, must be done in a very um, uh, careful manner, no, because there are a lot of people who believe that COVID-19 is a figment of imagination. A lot of people believe that it is a money-making enterprise by the big pharma, by governments, by vaccine manufacturers. No, but really, you really cannot discount the fact there are a lot of people who are dying. No, and maybe later, Vanguard Vallejo can talk about the detection of COVID-19 through RT-PCR, because ano siya he works with the RT-PCR. So, we cannot discount the fact na maraming namatay na. In fact, in the Vanguard community, we know, that
Yes.
we have already have had some casualties. And we have had brads who have had COVID-19, and many have survived, of course, no? But we have had some casualties already. So, with this talk, we hope to allay the fears. No, with this talk, we hope to clarify some issues.
And, Professor Vallejo.
About the
Misconceptions.
misconceptions.
Yes.
Okay, I think the first big misconception, which is now I keep on hearing now, is because we have been living with it for a year. Some people treat it just like a sipon or common cold. So medyo they lower their precautions, no?
Complacency.
Because people think that okay, it's just like a cold, no? I can get sipon and I won't die from it, and and so I should start reducing my precautions, like maybe mask. Even in workplace conditions, they take off their mask, or their face shield pag in a crowded place, or they go to crowded places. So I think that's one of the misconceptions. Nothing has changed about the how infective SARS-CoV-2 is, or the virus that causes COVID-19. In fact, it is likely that it is more uh, infectious based on the studies made on the emerging variants, no? Since we are in, I mentioned the word variant. The variant is a mutation that was conferred to the virus because we're not stopping the spread of the virus. So if the virus spreads, the more chances it will mutate. So perhaps the best thing to do is still to have the basic preventive measures like washing hands, sanitizing hands, wearing the mask, and avoiding crowded places. And as an added protection, put on your face shield.
What I understand is, correct me if I'm wrong, is that a virus can mutate if it's allowed to incubate in enough hosts. That's how basically is. Is that term too difficult, or how can you laymanize it in terms that the public can easily understand?
Maybe I can answer that, no? Mutation is normal for a virus, no? It needs to survive. A virus has no need for a dead host. Therefore, it will mutate to make itself, no, less virulent, less with a lower fatality rate, no, than the original, no. So when a virus transfers from person to person, it will replicate, in each person's body, and with each replication, with each baka pinaparami niya sarili niya sa loob ng cells natin. With each time it replicates, there is a chance for errors, or there's a chance for improvement, no? So if the virus just stays with me, no, then it does not need to mutate, because I'm not going to infect other people. If it wants to infect another people, it needs to transfer to Ben. When it transfers to Ben, it will mutate so that it can survive in another person's environment. No? Ibang antibodies ko, ibang antibodies niya. So it will change, no? But the change isn't that much, no? But if the virus transfers from Ben to you, Phil, no? So pangatlo na, there's a chance for mutation again. So the greater number of people it transfers to, the greater chance it will mutate differently, no? So parang ano lang yan, parang game of, hindi lang game of chance, no? But it's also a game of survival. It needs to change, no, every time it goes from one person to another, especially from one locality to another, and from one race, lahi, to another, no? Because Asians, we have a different constitution than Caucasians. Caucasians have different constitution than Africans, diba? So every time it transfers, it needs to survive. It needs to mutate. So all these mutations that has been happening now, no? We currently have 4 variants circulating here in the country. We have the UK, the South African, the Brazil, the P3 variant, which the government hesitantly does not want to call the Philippine variant. And of course, the 5th one is the original variant, the D614G variant. I think that was from Spain yata, no? Yung first, so 5 variants na nag-circulate na sa Pilipinas, no? And the entry of the variants, no? It can happen, we have new variants that can happen through either entry of new variants through our ports, or mutations inside the society or community. And I think we have both now, no? So mutations really does normally happen, no? That's why we have flu shots every year, for example, because the flu virus mutates frequently, no? So when you have a flu shot this year, no, it contains the variants which are prevalent for that year, no? What if it mutates? So you need another shot for the new variant the next year. So I suspect that after this year, once the vaccine rollout has been completed, we will have annual both flu vaccine and annual COVID vaccine to take care of the variants, no? We can never really eradicate something completely, no? Flu, we've had flu vaccines matagal na, but we have not eradicated flu, no? I think it will be the same pattern with COVID-19, no? So that's one misconception about viruses, no? That it mutates rarely. It mutates a lot, no? Frequently, no? Viruses can either mutate to become better, become more fit, no? Mas fit siya sa mga environment, or it can mutate to something deleterious to itself. It can die a natural death, no? Less and less and less and less virulent until parang naging ubo na lang, wala. And then our bodies can easily destroy it inside. it can become that, or it can become what has happened in Brazil, that's happened in South Africa and UK, no, more virulent, deadlier versions of the original.
Um, Professor Vallejo, there are some who says that, I've often heard this, yung death rate lang naman is 2.2, so we don't have to worry about it.
Mm.
Yeah.
How do you answer that kaya okay lang dumami, 2.2% lang naman eh.
No.
But it's a numbers game. If it increases, the 2.2% will suddenly become real numbers.
Yeah. We're doing kasi we're dealing with people's lives. So first of all, I think the question that should be at the back of our minds is, what if I am part of that 2%? What will happen to my family and my friends? So, and people who will care for you. So the impact of the 2% who are people who are going to die is much greater. The burden on families is really much greater. So hindi natin pwede sabihin 2% lang yan. No? It's not just a statistic. No? Now, if we were just caring for farm animals, perhaps we can be a little bit more thinking like that. No? We can easily replace the 2% with a new chickens. Di ba? Let's say it's a chicken with eyes. No? But we're dealing with people. So I think the 2% is also a big burden, no? Kasi in the first place, as I said, if so many people get infected, let's say for 10,000 people, what is 2%? 200 people.
200.
200 people will die. Can you imagine the cost of that to the families?
Yeah,
So,
and
just for that point, for that point of view, I think we really need to stop the viral infection.
because if we don't stop the viral infection, let's say that 10,000 grows to 100,000, then that would be in 2,000. And if there's a billion infected, it's okay. That's 20,000. It's inversely. How do you say this? It becomes, the larger the figures, the number of cases, that small 2.2%
Proportional.
will become real numbers,
Mm.
real people that.
Okay,
Unfortunately.
there 2% might be a seemingly small number. Okay, 2%. But consider how many families have members who have comorbidities. How many families have parents or brothers um, who have hypertension, diabetes, no? For you you might not get hit by COVID, no? You might have COVID, but you might not die from it because you're not part of the 2%. What if you transmit that to somebody in your family who has comorbidities, no? Who are in the vulnerable sector? Tayo naman, as Asians in general, no, we have an extended family system. No? Normally, in one household, we live with our parents, our grandparents, di ba? Even up to the apo. No? Sometimes, isang bahay lang. And secondly, in our cities, no, we are crowded, no? Especially in the informal setting area, sector. No? And in those areas, talagang halo-halo talaga yung mga age, no? Mga edad. No? So, just bring one person with COVID. No? Yeah, the healthy ones will survive. Yeah, of course, no? But what about the elderly ones? Are you ready for them to have COVID and be part of the 2% fatality?
And then another thing that I think that should also be considered, correct me if I'm wrong, is that it's not just about COVID. If if those mild symptomatic cases have to go to the hospitals and to be confined, they will use up space, and they will have to devote medical personnel. And if the hospitals get filled up by those, what about the other people who are ill that needs hospital services? They won't have any. There won't be enough medical personnel to go around to treat the other illnesses or diseases.
Alam mo, that's a very true statement. No? It's very real. It's very scary. All right. An example is, almost right now, no? Siguro in Metro Manila, according to OCTA, is around maybe 60 to 70% already occupied, no? Utilization pala, utilized. The danger level is at 70%, so we're already there, no? Now, okay, what if you meet an accident in the road? No? Ano ka, you have back pain dahil nabumangga ka, gano'n, no? Gusto mo ba ang hospital, knowing that yung hospital na pupuntahan mo may COVID? Ang impact nun, mag-ingat ka talaga. Di ba? O, another one, you have a member of the family who has stroke, or has hypertension, or heart attack, no? At for 1 year, na-miss niya yung follow-up niya sa hospital. Dahil syempre, takot kayong pumasok. Ngayon, tumataas na naman ang COVID. Papacheck up ba sila? No? It's a very scary, Of course, the hospitals will allocate non-COVID diseases. Of course, no? Siyempre. Pero, if you are a person who just has to have a check-up, your monthly check-up or your annual check-up, will you do it now? The impact of that is that decreased a number of medical checkups this year and last year. Can you imagine how much yung non-communicable diseases ratio will be next year? No? Diabetes, so siyempre kumakain tayo ngayon, puro order na lang. See kung ano yung mga quality of food that we buy, di ba? Yung ating sedentary lifestyle. Ayaw na natin mag-bike sa labas, ayaw natin maglakad sa labas o magpunta sa gym kasi baka mahawa tayo, no? So everything points to the next step, no? Everything points to a non-communicable disease increase after COVID. After COVID, we might have a lot of hypertension now. The diabetic people already have baka hindi na controlled, no? We might have a lot of people who are nagiging obese na sila dahil walang exercise, no? So after COVID, may problema pa. That's scary, no? So we must stop COVID now, no? Para hindi dumami yung mga casualties na non-COVID, no? Right now, marami ng mental issues, and we know that. We've been reading about it in social media. Doctors have been saying, even doctors ngayon may mental health issue na sa dami ng nakikita nila na namamatay at nagkakasakit. Tayo, in the general public, the children, yung mga hindi nakakita ng kanilang mga barkada in school. There's homeschooling sila, di ba? Ngayon, no? So, tingin ko after COVID, the fight is not over yet. There's a lot of things to do after, no? Mental health, yung ating normal natin, yung sinabi ko na, hypertension, diabetes, etc. Dadami yan. Dadami pa yan.
Okay. So, anything else that you'd like to say, re-emphasize or add?
There's
to
one Phil, no? I think this is an interesting one kasi we're all Vanguard. This will be in the Vanguard, ano? I think Dr. Vallejo can give a very good comment on this, no? That one of the first misconception was this is a biological weapon developed by di ba? By China. Can you he gave me a very good answer. Sige, can you elaborate on, is it really a biological weapon?
No, kasi if we think it's a biological weapon without evidence, then that's an easy way to look for the cause, which is highly unlikely, no? Because the scientific data, as we have it now, is most likely it came from wild animals that were eaten. Or a wild animal could have infected an edible animal, yung farm animal in the Wuhan market. So those are the two possibilities, no? But regardless, it came from a wild animal, most likely a bat. Kasi it's now proven that bats are full of different kinds of coronaviruses, but most of them are not infective to people until the virus mutates and gives a chance to infect. Now, what happened possibly in China is the wild source of that virus. It could be a bat or a pangolin, which is used in
some medical
medicine, no?
herb.
Possibly because they were selling it in the market for a long time, so that gave a chance for the virus to mutate and look for an opportunity to infect other hosts, and that's how it started. Now, if it's in a biological weapons laboratory, it's genetically engineered, they should have made a vaccine to protect the soldiers that will deploy the virus. So far, there was no vaccine right from the start, di ba? It's highly unlikely. Like anthrax. Anthrax, they already have vaccines for anthrax
Yes.
because it's been
Pero-
been a biological weapon.
Pero definitely, and I think Vanguard Vallejo would agree that COVID-19 is is an issue of national security. No? Matagal na pinag-uusapan din yan eh. No? So with our we are also members of the institute, no? We were given a task by the chancellor to institute a program, no, for national security, and part of the modules will have to be lessons from this pandemic, no, from this pandemic. There are a lot of learnings, no, experiences from brags who are doctors, no, experiences from us who are science advisors and scientists, no. We put them all together, no, so that we can learn more about how to, in the future, how to deal with situations like this, similar to this, no, as in a context of national security.
Okay. Well then, thank you very much, Dr. Butch Ong, Professor Vallejo. Thank you.